that first session was quite inspiring and informative, and it really helped set the tone for the rest of the day, especially when we discuss the intersection of all these new technologies with the complex world of patient care. So now moving on. Our next session examines connectivity. Literally, are patients, doctors, medical centers, labs, and more able to connect, or are we all doomed to be running isolated proprietary systems that don't even talk to each other? Will we be able to surpass old hurdles and truly take advantage of new technologies to monitor, diagnose, and treat patients, or will legacy systems and practices hold us back? Our guests will dig deep and give us their thoughts on the state of things as they exist and what we need to do to make things seamless. We are lucky to have here our moderator, Charles Parker, Executive Director of Continua Health Alliance, which is a membership-driven company focused on developing an ecosystem of interoperable personal health devices. Chuck has over 20 years of experience in healthcare technology, policy, and the strategic design of evaluation and measurement strategies. He also has led national programs for practice transformation and has served on national committees for assessing adoption requirements. It's all yours, Chuck.
Hi. Good morning, and thanks very much for joining us today. I want to thank my panelists here today. You're going to hear a little bit more from each one of these individuals today. I do want to introduce them right quick, but we're going to go through them here after I have a few introductory remarks. But I want to let you know here, it's Chris Wasden, Managing Director for PricewaterhouseCoopers. We have Clint McClellan here from Qualcomm, Senior Director with Qualcomm Life. Tim Fowler, who's a Director within Cambridge Consulting out of the UK. We have Horst Merkle, Managing Director of IS for Roche Diagnostics, and Stephen Dean, who's the Global Healthcare Lead for Freescale. So just to get a little bit of background here in context, as we heard a little bit earlier, Continua Health Alliance is a not-for-profit alliance that's focused on the interoperability of personal healthcare devices. We've been doing this for about 5.5 years now. We now have more than 200, or approximately 250 members throughout the world. We focus on this interoperability to ensure that we are doing this on an international basis so that we don't go back and have to recreate this country by country from the standards perspective. Continua itself is not a standards body. We don't set standards. What we do is we work with the industry to select standards that are in that respective field. So for devices, working with IEEE, for services, for example, connecting over the back-end wide area networking services, working with HL7, working with the World Wide Web Consortium for security on those aspects, to ensure that we can connect and make sure we can package this all together. So Continua issues a set of guidelines that bring all these standards together in a described way. And what you want to get to in interoperability is you have to make some tough choices at times. You have to basically come down and say, look, it's either going to be A or B and with our standards today, and what Continua does is help the industry drive towards that. It has to be A or it has to be B. So we select a standard, we constrain that down so that you can get to that true interoperability in that respect. So with that said, Continua is a certification organization, so we do certify individual either devices, applications, or services on the back end to ensure that we can pass this information from the device through a handset, for example, into the wide area networking services, and eventually, as needed, in the network interface into the healthcare records, which would be electronic medical records, healthcare information exchange, or even personal healthcare records as well. But more importantly, what it does is it allows us to make sure that any company who decides to participate in a particular area knows that when they play their part, they now can play a part of the whole chain. They don't have to manage the entire end-to-end system. So device specialists who are, and you're going to hear from that, the respective aspects here today within the panelists here today. So Continua at this point has now certified 56 devices and services in the industry, and we expect to see that number continue to rise. We are seeing mass adoption of these technologies. Unfortunately, outside the US, it's predominantly driven in Japan and in Europe right now, and predominantly by the Japanese market, where the Japanese government has now specified the use of Continua technologies, for example, in the refugee camps from the Sendai earthquake and tsunami. So these are areas where we're starting to see this take hold, because it is a standards-driven opportunity. It's an opportunity for the interoperability of these devices. So with that said, I'm going to turn this over to the panelists to kind of give you a little bit of background as to why they're participating, why Continua is important, and then also to hear a little bit from their perspective of the interoperability aspect of this technology. So first up is Chris Wasden. Chris?
Sure.
You want to...
Yeah, let me stand up here. All right, there was a recent survey that was done among a bunch of us that communicate in the LinkedIn wireless healthcare network. And the question was, where is mobile health today, and how well is it progressing? And the bottom line view is that mobile health is at the first gear, almost in second. But after many years of development, we haven't really seen that inflection point where things are exploding exponentially. And one of the primary reasons is this interoperability issue that we've talked about. So I want to talk about some of the issues that are around that to set some context or frame the discussion we're going to have today. When we look at apps that are used in healthcare, what we find is that people are generally fairly unhappy with the apps that they have, and they change very quickly. So they'll download an app, try it once or twice, abandon it, and then move on to find other ones. And the reason is that the market is so new in such early stages of development that there's a lot of experimentation going on. And so it's easy to find an app that's better than the previous one, and you don't have enough invested in the previous one that you're going to hang on to that one. And so you're always experimenting, trying to find what's better. And a lot of it also is because these apps are not very user-friendly, they're not very intelligent, they really don't do much more than just give you some rudimentary information. So when we've thought about what makes an app and a device very successful in this space, we've come up with what we call the 6 principles of success. And the very first of the 6 principles is interoperability. If these devices and applications are not interoperable, then the rest of it almost really doesn't matter. But after interoperability is achieved, then we've got to have the apps really integrate into the lifestyle and activities of physicians, of patients, consumers. We can call patients consumers as well. And then we increasingly want these apps to be intelligent. We want them to do more than just take in data and give us back the same data. But we want them to interpret the data and then give us recommendations about what we should be doing differently because of the data that's been collected so we can change our behavior. Over 50% of all healthcare costs are associated with bad behavior. So unless we're really talking about changing patient behavior, we're not going to be doing anything with regards to changing the healthcare system at all. And so that's what these devices can do. That then will generate better outcomes, both in cost, access, quality of care. It will socialize it among broader communities so that you've got people collaborating with one another. And then finally, they'll become engaging and interesting, and they'll have stickiness so that you're going to want to use them again and again and again. So as we think about that, what we've done is we've broken down this ecosystem into 3 primary buckets. The one bucket we call personal connected health world, and that's the world in which we get the health and wellness apps. We really don't share them with our doctor. We don't share the data. We share it among ourselves, our family members, perhaps other coaches or people that we work with in a very consumer-oriented, wellness-oriented environment. On the far right-hand extreme, your right hand, is the clinical connected world. That's where the doctors are using mobile technologies to connect among themselves within the clinical environment to better deliver health care. When those 2 worlds collide, that tends to be an area of remote patient monitoring. You tend to have call centers involved. You tend to have data flowing between the patient and the clinician. And that is a world that then enables the physician and the patient to start modifying behavior based upon clinical income or inputs and activities. The question was asked earlier about the FDA and regulatory approval. What you find is as you move from left to right, the regulatory hurdles increase and get higher. The vast majority of the activity, however, is really not that interesting to the FDA. I was with the FDA just last week talking to Jeff Shern, who's the director of the medical device area. And he says, we as the FDA really don't want to get too involved in too many of these mobile health digital technologies because we don't want to slow down the level of innovation. Where things are new or different or risky, we do need to get involved. But a lot of the stuff which is actually just putting into digital form something that's been in paper form before is really not a priority. Even certain levels of intelligence do not require the FDA's approval. And now the FDA has actually come a long way in the last 2 years, and so this is kind of the state of the art of their thinking. And also from a payment perspective, on the far left-hand side, you're paying for it yourself. As you move to the right-hand side, it's going to be paid for by a payer or provider. So this is me. That's me with my biking helmet on. This is my personal health record. Actually has no clinical information in there at all. But what happens is, as you start to see what I am doing as a consumer in the personal connected world, you start to see the need for interoperability. Okay? So I've got my Fitbit there on the left-hand side. Yesterday, actually, I got an award from Fitbit for going over 30,000 steps because you have to walk everywhere here because the taxis are so slow. So I've got all of that data that's being collected around the number of steps I take, the elevations that I'm going, the number of calories I'm burning. Up above, at the top, I've got my cycle meter app. I've got some other activity apps that are measuring my Garmin and other inputs with regards to my physical activity when I run or bike or swim. On the right-hand side, I've got my Wasden scale, which is collecting my BMI, my lean mass, my fat mass, my weight. And you can see I actually lost some weight in the last year or so. And then I've got my RestWise, which is actually using pulse oximetry and looking at whether or not I've got a low resting heart rate and whether or not I'm being fit. I do triathlons, and so I want to make sure that I'm fit for that. Down on the right, I've got my sleep cycle, and so I'm actually measuring how I'm sleeping, whether or not I'm very restful, how many hours I'm sleeping, how much of it is deep sleep. And then on the bottom left side there, I've got Lose It. And Lose It is, I actually am one of the 4 people in the world that actually lists everything that I eat every day. And so I'm gathering data and information about all that I'm eating, the nutritional levels, fat, lean, or fat, protein, and carbohydrates. So I've got lots of different measurement going on around me every single day. And if this stuff is not interoperable, then it becomes a real pain to really understand what it all means. Thankfully, the interoperability activity is starting to improve so that my Lose It application now integrates with my Fitbit. So now I get all of my steps and my calories that I burn into Lose It. I've also got some integration with some of my other devices like my Wasden scale, so I've got my weight there. But we need to have a world in which every one of these applications and devices interoperate with one another so we can then have a mosaic of what our life looks like. And so Continua is focused on this first of the 6 principles that I highlighted, interoperability. And Clint's going to talk about 2-net device in just a minute. But basically, we have 4 primary connectivity standards that have to drive interoperability at the device level, and then we have to have interoperability at the application level so that all the information comes together. And what I just showed you about myself was just on the personal connected side. But we need to have that on the clinical connected side, and we need to have that on the remote patient monitoring side, which connects all these worlds together. Okay?
Sure. Thanks very much, Chris. So we'll hear about, I'll have a chance to ask some questions here to the panelists as we go along here. But next we, Clint McClellan. Clint?
Great. Thank you very much. My name is Clint McClellan. In addition to working for Qualcomm, I'm the president and the chairman of Continua, and it's a great honor at this point as the market begins to take off this year. So much of the work I had done a couple of years ago helped make me even a bigger believer in Continua. And we hear standards. You hear Bluetooth, you hear Zigbee, you hear these different technologies. Well, they're standards, but they're all implemented slightly differently by different vendors. So 2 years ago, I got together with the Carlos Slim Health Institute and the West Institute, and we thought, hey, let's take an off-the-shelf phone and some of these off-the-shelf Bluetooth sensors, and let's build a remote monitoring kit for a remote care clinician, so a remote caregiver in the villages. So we began to put it together, and we realized that there were some slight nuances with this. I won't name the handset vendor, but they were using a proprietary Bluetooth set. I didn't know there was such thing. It seems like a misnomer, a proprietary Bluetooth stack. So we had to switch to another phone. And so we had to hire a developer to help us, because when you look at standard Bluetooth, as you all know, it roams around and looks for devices all around you, and it's sometimes a pain in the neck. You have to go choose. You don't want that with a medical device. You don't want a caregiver with potentially a 3rd grade education in the field to have to choose and to have to be their own IT person. So you hire a developer, and the developer comes in and helps with the helps with the pairing, helps with some of the privacy, but you're stuck with that developer. So we had this developer, and it cost us $10,000 per sensor to hook up. Then we had to switch the phone out. So the project is delayed for another 3 weeks while we try to research the Bluetooth stacks in the phones to make sure they're compatible. And so then there were some hardware issues. So that project actually, we backed out of that, and Carlos Slim and this Institute in West went on with it. So then we began a project with Apollo Hospitals. We got another developer that they integrated the Bluetooth. They solved the problems with the pairing, but with this one developer, the way he does it. And so then there was a delay in the project for about a month, and we didn't know what was going on. Well, what happened was, they didn't tell us, the developer, but suddenly the phone he was using was going end of life, and he wasn't sure which next phone to use. So, because he had to research the Bluetooth stack. So here we're stuck again. The same thing, deja vu all over again with the NIH. We're doing a project right now with the NAH, the Native American Institute in Flagstaff. We finally stabilized the phone and with some sensors, and we're monitoring some chronic disease, some patients with COPD. So, moral of the story. With Continua went in, and one of the most useful components right now is that Continua developed something called HDP, the Health Device Profile, which is a Bluetooth stack which improves the privacy, security, and the pairing. And so, but you've had to have a developer to implement that as well, so it hasn't been easy. But this year, what has happened, we just announced yesterday, we helped Android with the announcement, but Android 4.0 will have standard Continua HDP in it. So now you can take an off-the-shelf phone, you can find a sensor that's Continua compliant, and you can build these systems and get them to market quicker. So the lesson we learned, as Don Jones mentioned earlier, it took us a few years within Qualcomm to figure out what our business model was going to be. And we decided people needed help getting connected and getting to the cloud. So we developed this 2net hub. So this hub has the Continua Bluetooth radio in it, ANT Plus, there's a large ANT community, Wi-Fi, a USB port, and it also has 3G for backhaul. And what we found with the Continua radio, it was so much easier to integrate the radios because it's like you can't even get past Chris's, into the upper layers of Chris's diagram unless you can get past interoperability. So that's what Continua has solved, and it's at this point now where we have off-the-shelf devices that include this radio. And I remember going back to the board meetings every month, and everyone would say, why, is Continua, is this going to be useful? What have we done that will really help the industry? And I kept telling them, I keep running into roadblocks. I keep hitting these brick walls that Continua would have helped with. So we're at this point in the market where it's actually being deployed within commercial devices so that third parties will be able to get the applications that Chris is talking about up and running even faster.
Next, Tim with Cambridge.
Hi. I thought I'd start just by letting you know a little bit about who Cambridge Consultants are, because many of you probably never heard of us. We are a design services business who been running for 50 years, and principally we help our clients identify novel product ideas and get them to market rapidly. Our two biggest divisions are our medical technology division and our wireless technology division. I sit within the wireless technology division, and there's quite a strong overlap, and has been probably for the last 20 years, between our wireless technology activities and healthcare. We've been engaged in Bluetooth since probably the late 90s, having founded the market leader in the Bluetooth space. And probably about 5 years ago, when Continua first started, we identified this as a key enabler of a move in the healthcare space that we're also seeing in other market sectors, where people are trying to generally take standalone devices where they've usually provided some spot service, some spot facility, and expand them out so you can offer a wider service through integration and interoperability. And Continua was the first mover in the space to make that possible, to not only enable you to connect devices together, which actually is relatively straightforward, but actually to be able to define what the data is that you're sending. So when I send something, which is my weight, that the other end actually knows how I've encoded the weight and how to interpret it. And so Continua, in setting together some guidelines, we felt had unlocked a problem in the healthcare space that we'd seen unlocked in other markets. We've been actively helping our clients to implement Continua into their devices for the last few years, and a number of them that we've worked on are on the show floor today. Our interest going forward, obviously, is to help see this not only move into the connectivity and interoperability, but take it to the level where these things start to add value to people's health and not just to their ownership of things. I'm probably unusual here in that I'm not a health expert, I am a wireless expert, and I spend quite a lot of time talking to mobile operators. And the mobile operators think about this from the point of view of, hey, mobile health, this must be a great way to make some money. And the key thing that we're trying to keep them focused on is this: mobile health isn't about the mobile, it's about the health. And The drive for us over the next few years will be to see how we can use these things to actually drive better health outcomes at better productivity levels, such that you see both health and cost benefit for the users and for the medical community. So that's really why we're engaged in Continua.
Sure. Horst?
Yeah, Horst Merkle, you just gave me a promotion to Managing Director, thank you. I'm Director in Diabetes Care for Roche Diagnostics, and represent the few companies within Continua that really are deeply involved in the regulated space. And in the former, the prior session, there was a little question about FDA, and we can go into a little bit later. Just a word to what does it mean to be in a regulated space from a consumer perspective. The FDA and their regulation out there requires companies like Roche who provide devices, and that's another definition. We could also get into what it is a device. When we provide devices and the consumer calls into Roche and says there's a problem, we are responsible to provide a solution. Going back to interoperability, if we provide interoperability with nowadays non-standards, we would take responsibilities for technologies we don't even know how they work. So this is where the interest started for us in saying, okay, if we can help to standardize interoperability and also help the FDA, and this is really helping the FDA to get more clarity in the space. That is one motivation why we want to sit in Continua, and we're also sharing the regulatory working group, because the interest is to work with the FDA, with regulators around the world, to come up with standards and create endorsement by regulatory bodies to interoperability. And the key word is here, safety and effectiveness. We have to provide safe interoperability. It simply has to work. There's no room for error in this space, and that's one reason why we are engaged. The other reason is, when I started and heard of the founding of Continua, I said, that is a way for us to save cost. Unless other technology companies, I'm not interested to spend big money to come up with new solutions to interoperate. I want to have the assumption that stuff works. Then I can concentrate on the other 5 elements in your pyramid, outcomes, and bring meaning into data. That's our business, bring meaning into data. And that's where I want to spend my money, or Roche's money, not my private money. So that's it. That's our motivation, and we have been engaged in over the years into a lot of technical aspects and driving technical standards. But again, it is just serving the purpose to create interoperability as a base assumption in the regulated space.
Thanks, Horst. Stephen.
Yeah, thank you, Chuck. Stephen Dean, Global Healthcare Segment Lead at Freescale Semiconductor. It's important, the distinction that I add semiconductor to the back of that. So Freescale is providing silicon in support of our connected customers such as Qualcomm, Life, Roche, et cetera, potential customers. So that's a distinction that I want to call out. When I say device, it's quite different than when Horst here says device. My device is semiconductor in content that enables medical and healthcare, health and wellness OEMs. So Freescale, just like the others, a bit about Freescale before I get into Continua. Why Continua? Freescale has some legacy. We were born out of the Motorola semiconductor product sector, HC, microcontroller core. So we're broken up into basically 4 different product areas. So we're primarily an embedded company providing MCU, MPU, ARM-based, and Freescale-based processing solutions. But then also, of course, very strong sensors and micro-machine sensing, analog and power management, and then, of course, connectivity, both wired and wireless. And that pretty much comprises the company, 22,000 people and $4.5 to $5 billion in revenue. So that's Freescale Semiconductor. So my role within that is to ensure that I bring all of those products, all the technology and IP associated with those products to bear in the medical and healthcare space. Within Continua, it's been great for Freescale holding chair seats in past technical working groups and being associated, because for us, why Continua? It helps us enable our current and future customers in this space, the medical OEMs, but yet it also helps us and helps me define solid silicon that will continue to support them in the long run. So for Freescale, that's why. And I do have to say, to be a little bit more transparent, it's a great marketing arm for our company too, if you're considering joining Continua Health Alliance. It's been a great experience for us. So the marketing piece I'm going to throw in, I don't think has been mentioned yet. You get some good opportunities, you see a lot of things, and you get exposed to a lot of good people. So consider that, please. So with that, I'm ready to talk about what anybody else wants to talk about.
Sure. So we're going to open it up to audience questions. So if you do have some questions, I have a few. But I want to first ask Chris to back up his slides to the pyramid slide that he opened with, because I think that's sort of a key point that we want to talk a little bit about. Right there. So, this whole idea about, it takes interoperability to start to build the pyramid in this case. And I think that's one of the things here, again, you've heard, Continua starting to focus on that. But it's one of the key components for us to get to that point of integration. And how do we get to the next levels, which we're truly changing our healthcare system today, moving away from the proprietary standards, moving away from country by country specifications, so that you get economies of scale, you get the economies of being able to work with other organizations and plug and play in these types of aspects as well. So I guess the first question I want to ask the panel here and sort of toss this out to you as well. We heard this in the last discussion item, and this is around business models, and that each of you participate for specific reasons, but what are the business models that you're seeing come out of this particular area? Are you seeing anything specifically? You have reasons, obviously, that you're financially driven. Your companies who have a board that's reporting, that you have to report to, and you're a publicly traded company, so there has to be a profit model at some point. So there is some business reason for you to participate. So what do you see in this particular area here from Continua in that, or from the area of interoperability? I'll open it up to any of the panelists who want to start. Horst?
Well, I started as Roche Diagnostics being #1 in blood glucose monitoring. What we see worldwide is commoditization of blood glucose monitoring. And nowadays, we need to focus on services outside of just selling strips and meters. And we need freedom to operate and to do so. We need to have this interaction, and it's in one of your slides, Chris, where you have the consumer on one side, and believe it or not, diabetes care, even though it's a medical device, it's more consumer oriented, and you have to create this link to the clinician. And this has to be very effective, and this is what we want to focus on. So we have to expand our model from just selling strips into providing value and give meaning not only to the physician, but also to the patient, to the consumer. I want to throw in, there is a worldwide shortage of physicians and specialists, especially in the diabetes area. So we want to also we have to move more power to the consumer. So this is just adding to that in integrating data, because diabetes is not a standalone disease. It's something that is heavily linked to all the cardiovascular diseases, to stroke and kidney issues, and so we have to spend more time and better services into the integration of data. So it is just not a new business model, but we have to expand our business model to be successful in the future. And Roche is doing a lot in this area.
I've got a little story to tell about business model and how it works. In the UK, they're a few years ahead of us with regards to trying to decrease the number of patients that get readmitted into hospitals after some sort of a cardiovascular event. And so British Telecom worked with NHS there to provide remote patient monitoring to patients that were discharged so that they would not be readmitted within 30, 60, 90 days. And NHS agreed to pay for this service for the patients. After about 90 days, the British Telecom people came in to take all the devices out of the patient's home because the time had expired. NHS was only going to pay for 90 days. And the patient said, wait, I don't want you to take this out of my home. You know, I like what's going on. I feel comfortable when I know that there's a doctor or nurse on the other end monitoring me and making sure that I'm okay. Now, what's interesting is that those same patients would never have paid for the service themselves at the outset, but after having had 90 days of experience with the service, they didn't want to lose it, and they were willing to pay for it themselves after they'd experienced it. From a business model perspective, part of the problem that we're having with a lot of these solutions is that because they're so new, patients don't understand how valuable they are, how useful they are, how they would even work. And so we've got to get people to experience these things and use them and find out how useful they can be so that we can get them to start paying for it themselves, because they have the discretionary income to do it. And we've had studies where people have gone into Best Buy to look at some of these monitoring solutions that Best Buy will provide, healthcare oriented. And when they find out that they've got to pay $20, $50 a month, they go over and look for the 50-inch screen LCD TV instead. You know, they have the money to buy the TV, but they don't want to spend 20 or 50 bucks on their own health, even though they have the money. But it's because they don't perceive the value. And so I think that the key is, you know, putting together these interoperable solutions that are simple and easy and elegant, and then having them experience it, because once they experience it, then they'll be willing to pay, but we've got to get them to that experience.
I see this paralleling the cellular in the sense that we need to get it to the consumer, but there's a chicken and egg. How do you get it to them? So I was one of the first cellular analysts in the world, probably in 1996 or 97. And at that time, I was living in the Bay Area. Sprint was deploying their network, and they had the little map of the region 30 yards off the freeway that you could get coverage. And then they showed 500 yards the next period, and so they showed the map of the coverage. The phones were also $1,000. This is when the StarTech first came out. So we were all forecasting and thought, okay, this is an executive market. It's for business people. That's about it. And so I had my first lesson in Moore's Law, and many of us probably did because consumer electronics weren't that prevalent. The StarTech went from $1,000 to $300. And we began to realize, oh my God, if this keeps coming down like this, I'll be able to afford one. I think I was in my early 30s at the time. I can't remember. But I ratcheted my forecasts up and thought, boy, if this is the way this is going, why wouldn't I want to make a call wherever I am? And there were other analysts that said, no, people will never get used to end and send. And I thought, if that's my competition, this is going to be a great market for me to be in the analyst market. So suddenly it becomes a consumer market, and it's just voice. Same thing happened all over again with BlackBerry. It was just the executive tool for email. BlackBerry was associated with this proprietary network. Then the Moore's Law hit again, and now, how many of you have a smartphone in the audience? Okay, how many of you have email on your phone?
No.
How many of you have more than one email account? That's remarkable. Who would have thought that 5 years ago, 10 years ago? The same thing is going to happen in this market, and that's what Continua is allowing, is now what we want to do, like the VA right now has 6 proprietary systems for home monitoring. They use the same weight scale across, but they can't buy one set of weight scales and distribute them. This is the problem. So what we want to do within Continua, and this is what we hope our hub will help with, is disaggregate the connectivity and leave it to application developers that come say, you know what, I want that scale, I want that blood pressure cuff, and I'm going to use this hub. And I'm just going to get to developing apps and forget about the hardware piece. And that's where Continua, with this plug-and-play environment, really makes this look like the cellular environment. I mean, the things you can get on your phone right now are remarkable because of the interoperability. So this is what Continua will begin to allow.
And from that cost perspective, let's just put that in perspective with regards to those 6 proprietary systems the VA has and what Clint just showed you with the 2-net device. So the previous business model for the FDA, or for the VA, was that they would provide a hub device that would cost around $3,600, and then 4 or 5 peripherals, a blood pressure cuff, a glucometer, a pulse oximeter, a scale, at about $100, $150 per device. Some could even be more. And so the total cost for putting remote patient monitoring in a patient's home was around $5,000, right? Pretty expensive proposition. Most consumers are not going to do that. If they're not going to spend $5,000 on their flat screen TV, they're not going to do that for remote patient monitoring. What's happened now is by using cellular technology, things like the 2-net hub, you're eliminating that $3,600 hub cost and taking it down to around $100. Okay, that's a pretty big Moore's Law improvement. Okay, $3,600 to $100, right? And then you've got these other peripheral devices, and they're coming down a bit in price, not a whole lot, but call that $100, $150. So now you're taking the total price of entry from $5,000 down to about $1,000. Okay? So as you start to get that price of entry down to something that's much more reasonable, and again, 500 down, or 5,000 to 1,000, again, is a Moore's Law improvement. Now you start to make this thing much more affordable for the average person to either pay for themselves or to get access to. Because when you look at it from a business model perspective, if you're providing a service for a patient on a contract basis for 2 years, say, the remote patient monitoring service can be priced much like your cell phone. So my iPhone 4, if I were to, or 4S, if I were to buy it new without a service plan, is around $700. With a service plan, it's $200, plus I've got a 2-year contract. So the economics tend to look a lot like that for these remote patient monitoring solutions, where I could get into it for a couple $100 with a monthly contract of $30 a month with that sort of a price point. So the business models can now start to evolve to be much more competitive because the costs that are associated with putting this interoperability together are declining rapidly.
Yeah,
Stephen.
so in support of Chris and Clint here, my business model, again, is from a device perspective in semiconductor. I support what they're saying. We here at the show and the Digital Health Summit, you can come by and see, but we've got a pod there that shows a home health hub reference platform. And this reference platform, I have to really call out the fact that it's a reference platform and not a medical end device. It's intended to support our medical OEMs, such as Roche or Qualcomm Life. It's set up with, the interesting thing is, I call it the kitchen sink because it's got sub-gigahertz radio, Bluetooth low energy, Zigbee on the front end, Wi-Fi, Ethernet on the back end. It's got hooks for 3G cellular built into it. So it's the kitchen sink of connectivity so that our medical OEMs can pick and choose what connectivity method. Of course, health device profile is integrated within that, and we are going to go forward with Continua certification early in 2012. It's available in towards the end of Q1 in 2012. So once you pick and choose what you want to commercialize out of this reference platform, the BOM cost, the business model, is $20 to $50. So you can integrate a great deal of connectivity and empower yourselves to connect to the 50 some odd Continua certified end devices. And that's, I think, in support of everything that we're saying here.
Sure. So we heard a little bit about the telcos, and the perspective that, maybe the telcos are going to get in this market relatively strongly. And Tim, you had mentioned a little bit earlier that you do a lot of work with the telcos. Do you see this as the sort of the next wave coming out where, as a business model sort of described by Chris?
I think definitely there's a wave of activity that will involve the telcos, but I think the business models from their perspective are still, it's very early days. And the question really is what revenue that is generated by these connected technologies is saving you somewhere else? How is improving people's managed health in one domain, reducing the cost of later treatment somewhere else? So the problem of focusing only on the cost of the connected health is you're not looking at this holistically as actually what is the overall economic driver. If it was only about how do you spend money on connected health, then it would only be how do we overall increase the cost of medicine, how do we increase the cost of medical treatment. And that isn't the aim. The aim of investing in this technology is because there's a strong belief, and I think quite a lot of evidence, that investing in these technologies has a reduction in costs of the consequence of not doing something. And connected health is, it's a bit like an insurance scheme. You take these activities now, and then when something bad does happen, you've either mitigated it, reduced the impact of that, or in actual fact have prevented it occurring at all. And so the business models we're looking at is all about how to try and find the way of identifying the real value of what that overall saving will be in order to get the value for the service you're then offering. And unfortunately, I would say that the issue with any medical treatment regime or any sort of medical management is it actually takes a little while for us to understand truly what those what those costs are. So in the UK, where there are a number of trials ongoing, it's interesting because while it'd be nice to sort of have a big budget to simply invest in these technologies and work them forward, money's tight. We're in an austerity period. It's not easy to find this money. And it's interesting to see that where these trials are going on at a sort of grassroots level, local clinicians, local GPs have actually decided to take their own money, cut their own costs, reduce staff in some areas in order to put money into these technologies because they believe it will long-term save them money. And so we're seeing sort of embryonic trials at both a micro level. At the end of the day, if it's going to be a medical impact, it's going to have to be physicians who prescribe these sorts of mechanisms. And we're seeing people at grassroots level starting to do that. And at a similar point, at a macro level, we're seeing people who have fairly ambitious plans and large amounts of investment. Qualcomm Life have put a considerable amount of investment behind this promise. It's not just, hey, we have a product, but they're putting money into it. To actually help us go from the point where there is an investment needed to introduce the technologies to the point when we get the payback, which is reduced costs to get better outcomes.
And let me address that just a bit. The VA has done the most extensive research on the economic benefit of remote patient monitoring. They monitor right now about half of all the patients in the United States that are remotely monitored done by the VA, around 100,000 patients. And they've done that analysis over time and across almost a dozen different chronic diseases. And what you find is, and this isn't a surprise obviously, but some diseases are worth a lot more to monitor than others because they're a lot more expensive. So congestive heart failure is one of those which is very expensive. If a patient has an event, it can cost $20,000, $30,000 in a year. And so trying to prevent that sort of a cost is worth investing quite a bit of money. But on average, for patients that have congestive heart failure, what you find is that you can actually decrease the average cost per patient by doing these monitoring solutions by around $7,600 a year. So if you're the VA, you're willing to spend a few $1,000s in order to save $7,600. And our basic analysis suggests that the VA and other providers and healthcare payers want to have something like a 4-to-1 ROI on their investment. So they're willing to pay 1/4 of the cost that they're going to incur by preventing an event in order to invest in that insurance type of prevention. And other studies have been done by others that also indicate that there's this level of investment and return, such that solutions for remote patient monitoring can be priced as high as around $150 a month to as low as $1 a month or whatever, depending on the type of solution. And then you have to look at that across the different types of chronic diseases that are measured, because remember, most of the healthcare costs in this country, 75% are chronic disease oriented. So the real numbers that we're going after are chronic disease oriented numbers, which is decreasing healthcare costs by keeping people in their home and out of the hospital. And the problem is the old business model in healthcare was that revenues occurred once you hit that hospital. And so the business model said that it is success to have 6 people. Okay, so what we're doing by focusing on remote patient monitoring and chronic diseases is saying, no, it's a failure when you go to the hospital, not a success. And it's success to keep people in the home, and keeping people in the home can save us $5,000 to $10,000 per patient per year. And that's the economic rationale for investing in the patient. But again, if you look at the types of disease, the level of acuity of the disease, that determines the amount that is appropriate to invest for that connected health solution.
And I want to just thank you. That highlights a couple of things. It's easy to measure these type of things, admission in hospital, because that's a hard hitter. But coming back to diseases like diabetes care, like diabetes, people have diabetes for 15 years and they don't even know it, right? And this is the cost comes down the pike 25, 30 years. And this is where it's really difficult to estimate outcome benefits, because it has also to do with lifestyle, right? It is lifestyle changes, and this is much harder to actually get a grip on and say how much impact would that have in 20 years if you prevent that. So just want to, when we talk about business models, it looks good for all the higher acuity diseases. It is no doubt, but when you go to other diseases, onset of cardiovascular diseases, how to prevent that. And now I come back and say, how do we do that? It is, we have to get to a point where we can spend more money in coming up with programs, services that helps to monitor all the different factors. I mean, here is 1 out of 4 people in the world who monitor all this stuff, right? I don't do that, and I would say the vast majority doesn't do that, but it is something where we have to say, without interoperability, we don't even have a fighting chance to come to a world where we gather information. Yesterday I went to one of my favorite car manufacturers here in the show, and they have this new system, and every month the car sends, I get a report on the internet how my car is doing, right? So what I took away from that is, I know every month more about my car than I know about myself, right? And this is satellite connected. And isn't that a sad story that we are willing to pay money for that, but then at the back end it is very difficult to get people to pay $20 a month, $10 a month to monitor their health. And this is where I think we have to also get to a point where we can motivate people. And again, this comes back to what I said earlier, interoperability has to be an assumption so we can spend time on the service and make it easy to use and interesting for customers to monitor their health.
Part of the problem is, gets to Horst's point about motivation. You know, 1/3 of Americans are obese, 1/3 of Americans are overweight, and within 10 years, it's predicted that half of Americans will be obese. Okay, what that tells me is that we don't value health in this country, and it's not just this country; it's a trend globally. All right. Because if we valued health as much as we valued our cars, we'd actually care about getting the information. The problem is that most of these these monitoring technologies are actually going to tell us we're ugly, right? So how many people want to subscribe 20 months to a frequent email
Correct.
or some sort of app that tells them that they're ugly, right?
Yep.
And the good news is that there's actually ways to be unugly. You know, you can become attractive, but it's a lot of work and it's difficult, and we don't really value it. And we only value health when we don't have it. But when we have health, it's kind of ignored. So when you look at the #1 reason that we have cardiovascular disease, diabetes, and whatnot, it's not that we don't have a pill to fix it. It's not that we have genetic predispositions towards it. It's that we're overweight. If you could fix one thing in the world that would decrease healthcare costs by half, it would have people eat better and exercise more. That's 2 things, sorry.
Just to interject and let you go, did you know if you work out 30 minutes a week, you reduce your risk for diabetes by about 35%? 35 to 40 minutes a week.
Yeah.
Just I let you go on.
And one of the main problems, what the real biometric we all probably have is just weight. Well, that doesn't tell me how fit I am. You can add a pedometer in there, that's great. And to your point, Chris, you know you're not doing what you're supposed to do. Chronic disease is lifestyle based. Well, with interoperability, what we can hopefully do is have all these companies giving us enormous dashboards, giving my sleep, giving my activity, giving my blood pressure, giving my glucose, and at the end of the month I get a report and I can move these little levers. I can realize, oh, my blood pressure went down and my activity went up a little bit. My blood pressure went up and my activity went down. And you can begin to modify. Yeah. You can't expect people to completely change behavior, but you can modify it, but we just don't know what to do. And to Horst's example, imagine if you had a car with no speedometer and no gas gauge. You just get in it every day. That's pretty much what we're doing right now. We're just hoping everything's going to be all right, especially me hitting my 40s, my mid-40s. It's like, I was a pretty extensive athlete a long time ago. I'm trying to keep as busy as I can, like most of us. But if we can have a dashboard, but you can't have a dashboard without the interoperability.
All right, well, I think we're coming to the end of the session here. I want to say thank you very much to the panelists here, and appreciate their comments and appreciate the interactivity that they've had here today. Certainly appreciate you attending today, and hopefully you learned a little bit more about some of the activities that we're doing here and some of the issues that we're facing here within this particular industry. So, as the lead of Continua, we face these challenges as an industry, and we're helping to try to bring this coordination to the market space so that we can focus on those activities overall, not only here in the U.S. but across the globe. So, these issues are, as you heard, are not here specific to the U.S. They're also globally mandated. We see this as a significant issue in Japan. We see this even in emerging markets, India, China, as well. And so working with these areas to specifically focus on those opportunities. So I do want to say thank you very much. If you're interested in actually learning a little bit more about Continua, please join us. We're downstairs in booth area 3027, and we do have some demonstrations of the technology and what's actually being accomplished, as you heard from Stephen today. So thank you very much.